my screen, first I got to go straighten his ass up. My point, and that's a simple story, but what it really illustrated for me at the time was she didn't know how. We assume they have the skill. We yell at them, we threaten them, we beg them, we try to motivate them, right? We try to do all of that, and we assume they just don't want to do it. She didn't like getting in trouble. She didn't like letting her family down. She didn't like having me get mad at her. Most of these kids, they don't want to hurt their mother, they, whatever, right? But what happened? What did they say to you? I wasn't thinking. All right? They just don't realize the thought process. So, how did I change it? I modeled it, practiced it, I reinforced it, I made it more difficult. I used punishment effectively, right? I didn't just punish. The problem with Punisher is it doesn't teach you what to do. It only teaches you what not to do, right? And some people are pretty immune from it anyway. All right. The most effective behavioral approaches are structured social learning, where new skills and behaviors are taught and modeled. All right. I was using structured social learning. Structured, by the way. The problem with social learning is we don't just learn good things from other people, we learn bad things from other people. Social learning is a very complex process. It is not a complex concept. It's an easy concept to understand. How many of you have children? How many of you turned into your parents when you had children? All right. Some of us said we'd never be our mother or our father when we were 15, and you turned into your mother. All right. You woke up one day and there you are looking in the mirror, thinking, I'd never say those things. Allie, she's my youngest, and when she was a teenager, she said, when I'm a parent, I'm going to let my kids do whatever they want. I said, you go right ahead, Allie, you just be home at 10 o'clock. I turned into my father, right? I said, say things I swore I'd never say. You're born in a barn, you think money grows on trees, and I give you something to cry about. That's always my favorite one. I said to my son Michael one day, I said, Michael, do I look like Rockefeller? He said, who the hell is this Rockefeller guy? I said, I'm sorry, do I look like Bill Gates? I used to think that social learning, structured social learning, was going to be done primarily in structured groups and structured programs. But I'm changing my thinking on that. We've developed a new training for probation and parole officers called EPICS, Effective Practices for Community Supervision. I think we're going to be doing some training in Richmond here this year. And with this model, what we're trying to do is to teach probation and parole officers how to work differently when they meet with kids. Because what we've found is it's not very effective what we do now. And so we're trying to change that. And that's the model. Family-based approaches to train family, and that's the operative word, train family. It's not about meeting with them and telling them what you're doing with their kid and singing Kumbaya and all that stuff. It's about teaching them how to handle their children, how to do better discipline, better supervision, work on problem-solving skills, work on communication skills, right? Because the effects can be pretty substantial. And of course, cognitive behavioral approaches. Cognitive behavioral that targets the thinking and the attitudes and the values. Effective interventions use behavioral approaches. Why and what are they? First, they focus on current risk factors. Very important. I find, especially in the juvenile area, much more so than the adult area, we have a tendency to want to target what I call responsivity factors. We want to focus on the barriers to targets, self-esteem. We want to focus on trauma. We want to focus on the fact that their fathers abandoned them, right? Problem is, you can't change that. It could very well be some of the reasons that they're there. But behavioral interventions are focused on the present. Okay? You're not going to school. You think it's okay to use drugs, right? You think it's all right to run with a gang, right? Those are your current risk factors. And so, to the extent that the barriers are getting in the way, we have to address them. But we spend all of our time, I think, on the barriers, and we never get around to the risk factors. So if I've got a kid, if I've got a young girl who has really low self-esteem, she's been told every day of her life she's stupid and ugly and all of that, right? So what's her, she's thinking, I can never be anything. I'll never be successful. So what do, right? Right? We've got to address that because she's not going to move forward until we do. But that's not our target for change. That's our barrier. Our target for change is she's using drugs all the time. She's not going to school. She's sleeping with everybody she can find. Those are our targets for change, not the self-esteem. It's getting in the way. But if we just increase it, we'll just, we'll have somebody who's happier about those things. It's action-oriented. Behavioral interventions are action-oriented. And that's what I'm trying to demonstrate when I talked about the process we're at. It's not talk-oriented. Talk therapy is not an effective way to change kids' behavior and to teach them new skills. You got to show them, they got to practice, you got to make it more difficult. Sometimes they're going to screw up, and that gives you an opportunity then. And you may say that you look, there's going to be some consequences, but clearly we have an opportunity now to go back and work on this problem and this skill. And appropriate reinforcement. That means you have consequences that are well designed and well thought out and are tied to the behavior, and you have rewards. And rewards need to outnumber punishers to be effective. All right, I've probably talked too much, so I'm going to stop now, and I will answer, I left some time for questions. I will answer any questions that you have. Free now, you might as well ask me now. Yes, sir. Yeah. Yeah. Quick and dirty way. Yeah. Yeah. The question is, obviously, not everybody can have, folks come in and look at their programs, and by the way, and I think, obviously, at the university we come in and do that work, but it's a never-ending process. All right, I come in and look at all your programs today, but my guess is they're going to be much different programs 2-3 years from now. So you really have to figure out kind of how to do this yourself. You're absolutely right. There are guides and there are things, and I certainly can send them to you. It's one thing to assess a program, and you certainly could build some capacity to do that. Another way to do it is to start looking at measures. For example, when a kid comes out of the program, you reassess them. Is their risk level going? If it's the same as when they went into the program, behavioral indicators. If the program's supposed to be targeting substance abuse, what's the drug test tell? You don't need, and then I think it's incumbent on the program. You can invest a lot of resources going out and monitoring these programs. I can show you how to do that. But at the end of the day, it's really making sure that they're doing the things. And so it's really pressure on them. Are they contracts? Well, can you do performance contracts? You say we expect these outcomes. I know Lansing's doing that now. They went from just units of service to performance. So I think they have to start moving in that direction with providers. Because if not, you're spending all your time assessing the program and fighting with them about why they should be doing this, rather than saying, well, look, we sent 50 kids to you last year, and when they went in, here's where they were, and when they came out, here's where they were. And we're not going to keep doing business that way. Yeah. Well. Yeah. 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 It's a common problem. It's a common problem. and you know, unfortunately,